I'm Chris St. Clair. You're with the Weather Network, another episode and podcast of Viral Weather. We want to talk about COVID-19 and your mental health. Steve Lurie is the Executive Director of Canadian Mental Health Association in Toronto, and Martin Ricketts Jr. is a clinical social worker, retired in New York. He's a consultant now, but he's worked for the New York City Department of Health, and he's kind of at ground zero for where it is at in America. Also, Sumon Chakrabarti will join us from Trillium Health Services. He's working on the front lines with COVID-19 in Mississauga, Ontario. So let's begin. And I just want to quickly go to Steve, because the Canadian Mental Health Association has a whole toolkit out and a policy for how people can keep their heads straight through all of this.
Yes, and we have a number of resources that are posted on our website, which is toronto.cmha.ca, and we invite certainly members of the public to have a look at that. And I was saying there's a wonderful toolkit called Tolerance for Uncertainty, the COVID-19 workbook by Dr. Sachiko Nagasawa, who's a Canadian and has some really practical tips on how we can manage this. I mean, it's a challenge to all of us. I mean, at CMHA, most of our services are provided to people with serious mental health issues. So we've been focusing on trying to keep our clients safe, our staff safe, and also, in particular, how do we keep essential services going. The mental health services in the community have been designated essential services here in Ontario by the government, and we're very appreciative of that. We have people in residential settings that we're trying to keep in those settings and keep those settings staffed. We also deliver medication in the community, and we've got mobile nurses visiting people, or people are still coming to our office to get their medication every day. But the other really bright light, if there is a bright light in this, is that we have really moved to providing a lot of virtual services in terms of peer support and counseling. And really neat things are happening so I imagine that post-COVID, which we hope is soon, there are going to be things that we have learned to do during this crisis that we'll carry on with.
And I want to talk to Martin for just a minute, because you're in New York City, and people are self-isolating, and we're social animals, people. So this is not normal for us to be not with anybody except maybe just our mate. Is there such a thing as too much togetherness?
If you're not used to it, we are fortunate. I live with my wife. We were both retired, so we ended up spending a lot of time together in the last couple of years, actually. But folks who have a routine, they get out of the house, they go to work, they interact with neighbors, they go to the store, they go to the gym. If all of that is taken away and you're forced to be home, little things become more irritating. And especially if you don't have a lot of space where you can kind of separate and be individual and kind of go to your neutral corners from time to time. So it can be challenging because your routine is gone and you're forced to do just basic things. Go to the grocery store, go to the pharmacy, maybe get gas for your car. Some folks now, the essential workers, are still out there working. So they're coming home stressed, So it can be a very mixed bag. It can be very challenging to maintain a good relationship in this situation.
Do you have a couple of tips to help people, just, things that they could do, on a daily basis, one or two things that make you happier?
Sure. Today is not a day that we had like yesterday. We had a beautiful spring day yesterday, and we each took a walk separately, got out, and, the whole idea of spring brings hope anyway. We see the trees blooming, we see the weather changing. So we're getting out and taking our walks. The day before, we scattered around, just took a drive around the neighborhood to see which restaurants, which of our favorite restaurants were open. So we're trying to get out. We also have a porch where we live, so we sit out from time to time, we read. And the other thing too is checking on friends and neighbors, through social media, text messages, Facebook, things like that. So we're kind of trying to reinvent ourselves. We were LA Fitness gym members, so we're trying to do a little modified routine in the house. We take turns doing that. With Netflix, again, we decide on what time is movie time. We'll try to watch a nice movie together. So we're trying to doing this as we go along, doing it on the fly. So it's trying to reinvent yourself at every step of the way.
It sure is. We've talked more about some of the problems that people may be facing at home, and you have some experience in that regard with your work in the penal system in the United States. But I want to bring in Dr. Sumon Chakrabarti in Mississauga with Trillium Health. How's it been for you just working with this on a daily basis?
It's been tough. We're starting to see more cases coming in. Thankfully, we do think it's going to start to slow down in the next couple of weeks by the end of April. But, I've seen multiple people with COVID. We have to be sure to protect ourselves. And it's a tough situation. But, I think we're handling it well. And there does look to be a light at the end of the tunnel.
Well, we were talking about projections, and you're saying that we're starting to see, because when we talked weeks ago on our first podcast, you said we need to flatten the curve. Are we doing that?
I think so, yeah. I mean, in Ontario, it's been a bit slower than other places like BC and Alberta. But if you look at multiple projections, it looks like things are starting to slow down. By the end of April, we will have already seen our peak. And I think by May, we're going to start to see this really grind to a halt.
Oh, okay. And so but we could possibly get back to some sense of normalcy, then you're thinking by late May.
That's right. Now, like I said on multiple other places, is that, we're not going to be having, Metallica concerts the first day we're back, but what we will be seeing is some of the restrictions being relaxed in a graded way. And, there are going to be more cases, but we have to keep a close eye on them, really good contact tracing, and really try to keep it under control.
Well, that's the thing, because everybody talks about there will be a second wave of this towards the end of the summer. So how do we manage that? I mean, it'll still be nice weather outside. It's not like people will be suddenly indoors again by September.
That's true. And, I can't wait for the great weather, but there is an issue with that, is that there's still going to be some level of social distancing, even in the summertime, I'm fairly sure. So one of the things that we're expecting is that we will probably see some more waves, but they're not going to be as bad as the one that's currently going on. And additionally, the strategy is to really, really look for every single case, widespread testing. And when you find these cases, isolate them quickly, do focused isolation, and try to keep these little fires under control until a vaccine is available.
So, and how long for a vaccine? Because I've heard a lot of people say, well, why can't we just use artificial intelligence and get a vaccine right away? But that doesn't work that way.
That would be amazing. You win the Nobel Prize for that, by the way. But yeah, it takes time. These things take time. And, the research groups are going to be quicker because the whole thing is going to be focused on just that one task, finding a vaccine for coronavirus. I expect the earliest is going to be late 2020, if not early 2021.
So that's actually some good news. As we slip into better weather, that's making us feel better in our heads, knowing that a virus could be just a year away. That's good light on the tunnel.
Absolutely. It's at least nice to see that something is, we're working towards something, if that makes sense. But yeah, it's been tough. And I think that we still have a long way to go, but we're going to start to see some changes, some relaxing in the restrictions, I estimate, at the end of May.
That's your estimation and opinion. I want to ask you about what Sweden is doing, because they're not handling this the way that we're handling it here in Canada. They're doing something called herd mentality. What's that?
Yeah, so herd immunity, actually. And, I'm a little concerned about what Sweden's doing. They have the right idea. We do need herd immunity because this helps to blunt the effect of an outbreak. The problem is with this particular coronavirus, is that you can get a lot of cases in a very short period of time. And what that does is it overwhelms the healthcare system, just like we're seeing in Italy and New York City. So I don't think that's the right approach. UK tried it briefly, and then they had to go to the approach that we're using. And unfortunately, they're paying for that. So, the medical people in Sweden have been writing letters to the government to say that we really should be doing social distancing there as well.
And just for people to understand, to explain how herd immunity works.
Herd immunity, the way it works is that, let's say if you have a population that has no immunity to a virus, the virus can very quickly spread to everybody because nobody's immune to it. But let's say if you have 80% of the population immune to something, as soon as the virus enters the population, it can't really go very far because everybody's immune to it. And then there's the people who are, say, very susceptible, like elderly individuals. They're protected because the virus is not spreading as quickly and will not get to them. And that's why herd immunity is so important for so many infections, including coronavirus.
And when we get to having an inoculation for this, how will that work? Will that will become just something generally rolled out, you would expect?
That's what I think. So I think what's going to happen, let's say 2021, early on, they find the vaccine. It'll be widely produced and then given initially to the highest risk people. But I do think it's going to be a vaccine that's for everybody because we need widespread immunity to this so the virus cannot spread like wildfire in a community.
Dr. Sumon Chakrabarti, thank you very much for your insight and opinion. We always appreciate it. This is Viral Weather, a presentation of the Weather Network. Our conversation about the weather and your mental health continues. I'm joined by Martin Ricketts in New York City, the epicenter in the United States right now, and Steve Lurie from the Canadian Mental Health Association. People are in a situation that has brought, Steve, every potential crisis in their life together at the exact same moment. You can't be with anybody. A lot of people have financial stress because they may be without their job, their income is reduced. The jobs will likely be there in the end, but this is like a petri dish for people to get in trouble upstairs, right?
Yes, well, clearly, if you weren't anxious before this, you may well be anxious now. If you weren't depressed before this, you might be anxious now and depressed. But I think part of this is recognizing what what is actually going on, and the good news is that with everything that governments on both sides of the border are trying to do, we are actually seeing less people be infected. So people need to accept that the social distancing and perhaps the inability to go to work or the need to work virtually has changed things, but most of us are not going to get COVID-19. And that's a good news story. At the same time, we know that even without COVID-19, if there's an economic recession or any kind of crisis, domestic violence, mental health issues, substance abuse issues increase. And that's been happening at least since the recession of the early 1980s. At the same time, I think Dr. Nagasawa talks about a really interesting concept. Really, we have to recognize the truth of the situation. We might not like, having to social distance, having to wear a mask, having to be at home, having to curtail when we go out. But we have to recognize the truth of the situation, that this is our reality, likely for the next 12 weeks, if not longer. If you look at what's been happening in other jurisdictions, China's just now starting to unwind. There was in the press today, Italy is beginning to plan for their unwinding. So I think your watchers and listeners need to recognize that this will probably be our reality well into May.
You can't escape COVID-19. It's everywhere you look. It's on Facebook, it's on Twitter, it's on every single television channel. It's up to you, isn't it, to limit how much information you take in?
It is up to you. We're somewhat fortunate in New York amidst all of the devastation that we have here. We have an excellent governor who really keeps us informed and involved and really tells it like it is. He presents the accurate picture. He talks about the really difficult situations here, but he also gives us data, and he's also giving us a sense of hope.
I think that's important with politicians. I mean, we're lucky in Canada because our politicians have been very direct with us, and nobody's taken it in a hysterical manner whatsoever. You also said that you had an interesting anecdote about this.
Well, actually, being very close to the epicenter, Elmhurst, Queens is about 8 miles from us. And we're in a more suburban area of Queens here. Elmhurst is a very dense area, densely populated, and it abuts another neighborhood in Queens, actually ironically named Corona. Go figure, right? But anyway, we're a little bit removed from the epicenter, but we were out and about, and my wife and I had both tested positive for COVID-19. Having said that, when we spoke a couple of days ago, it seems like I'm one of the ones that's been fortunate to be on the trajectory towards recovery here. The scary part of this for all of us here in New York is, again, the media. When you hear about younger people in their 30s and 40s just dropping dead like that, having worked at Rikers Island, there's about 400 staff members, civilian and correctional staff as well, that have gotten it. Close to 280 inmates that have gotten the COVID virus. And it's scary because people are still going home to their communities. We have 2 correction officers that live in our neighborhood here. So it's kind of like, okay, where do you go to escape the possibility of getting this? In New York, I don't know. But having said that, I think that being on the downside of this, last weekend was the first time we both started to feel a little bit better. We've been quarantining, we've been wearing masks. So I'm hoping that this is all behind us now at this point, but I feel that we're very fortunate because of pre-existing lifestyle situations. We're not smokers, we're minimal drinkers, we eat healthy, go to the gym. And mind you, we've learned that in New York, the highest population that's been seriously impacted are African Americans and Hispanic, more so African Americans. There's a whole lot of discussion about pre-existing health disparities, cultural traditions that keep people away and distrustful of the medical profession. So there's a lot of factors here that have impacted on the fact that so a lot of people have just caught this thing and died. So, but when you hear this in the media, it's very scary, and you're hoping that you're not one of those folks that'll happen to.
Okay, well, we'll think about you, and God bless you.
Thank you.
In Canada, Steve, there's actually a place you can go online to find out if you perhaps have symptoms of this, right?
Right. So if you're in Toronto, and I would imagine every public health unit has a link that you can go on to. For example, in Toronto, if you just hit Toronto Public Health, the page opens up around coronavirus, and there's a link to not only a self-assessment tool that you can use, but also a link that describes, if you've got certain symptoms, how you go about accessing an assessment center. And there are a number of them in the Toronto area, and in I would imagine every jurisdiction in Canada would have something like that. Also, the provincial ministries of health and public health departments also have good links with great information about how to self-screen and then how to get services. The focus really in Canada is, what might be determined as probable or suspected. So it's basically a combination of symptoms, fever along with a cough, along with the chills, and then they actually give you some good indicators, like if you have many of these symptoms plus others like confusion, lethargy, don't bother going to an assessment center, call 911. The other thing I might mention is that many medical practices here in Ontario, at least, have moved to virtual care. So people may want to check in with their family doctor to see what the virtual care options are. But I think it's really important that people put this in perspective. We do know now that it is possible to pass the virus if you're asymptomatic, which is why I think the advice about using masks has changed. And people should use masks if they are going out in public for those necessary errands. But overall, use the publicly available information either at your city public health site or your Ontario or your provincial ministry site, because it will give you all the information you need about what symptoms you may be having and how to access an assessment center.
And it's important to note a couple of things. First of all, asymptomatic means that you are carrying it, but you are displaying no symptoms of it, correct? So like I may have COVID-19 and not know it, and therefore I'm out infecting people, but I think I'm fine. And that's why the mask scenario changed in Canada.
Right. And also, Chris, that's really emphasizing the importance of social distancing. And if you're coming in from the outside, assuming even if you have social distance, wash your hands frequently for 20 seconds with warm water. Don't, even if you've been wearing a mask, take the mask off carefully, wash your hands, don't touch your face, because that's the way the virus passes.
Now, this is important, and I know, Martin, you can talk to this too. vulnerable people. A lot of them are, homeless, people who live in shelters. They're in a really tough spot right now.
They are. Shelters, as you know, are congregate care scenarios, and people in the best of situations do not really have that 6 foot space to separate themselves. Not to mention, it's sort of like the jail population too, especially when people are newly admitted. You don't know what people have. You have to screen them. You have to screen them for medical and mental health and substance abuse issues as well. So folks that are in homeless shelters, as well as the staff, are extremely vulnerable. Right now, there's a push to have corona vulnerable inmates released from Rikers Island. And on the one hand, the thought is that, well, this is going to save their lives. On the other hand, releasing people back in their communities who may or may not practice social distancing because they were incarcerated for not adhering to norms of society anyway, what is that going to mean for the general population at large here? That's another vulnerable population. The other population that's very vulnerable are people that are in recovery from substance abuse. They really depend on these fellowship groups, the face-to-face aspect of the group meetings, to dialogue, to share, to have that contact with each other. They're testing out some scenarios online, and while it could be helpful, it's not quite the same as having face-to-face in a group format there. So there's a concern that people could relapse because they don't have that interpersonal support and guidance and contact that they need so dearly. Um, those are just a few of the vulnerable population. The elderly, of course. We were worried about our neighbor of ours until we saw we have a program called SNAP, Service Needs for the Aged.
I want to interrupt you on that because that's a really interesting program. And that's a really important point that you made.
Yes.
Was that if you know somebody who's vulnerable, it's really important that we as a society take the time to check in with a phone call or a text message or something
Yes.
like that. We were talking with Martin just about vulnerable people and programs that are available to help people. Steve, there's a load of them, a plethora of programs that people can take advantage of here at home too, right?
Yes, well, here in Ontario in particular, the whole community mental health and addiction sector is focused on helping people with addictions issues or mental health issues stay in the community. So every single one of my colleague services, and there are about 250 of them across the province, are working flat out to, as I said earlier, keep their residential programs going, to make sure people get the nursing services they need. But we're also seeing some real innovations in terms of social support. So we're seeing a lot of peer counseling over the phone or using some of the technology that's available be made available. We are focusing on visits to vulnerable clients. And for example, here in Canada, and they deserve a shout out, TELUS has been working with the Focus initiative that the Toronto Police Force runs for people with elevated risk, and people are going to be provided with a cell phone and a data plan for the next 3 to 4 months. And it's a real shout out to TELUS for doing that. Also, the city here in Toronto recognizes the risk and the challenges of social distancing in the shelter system. And so they have been taking on alternate accommodations so that they can spread people out more. They're leasing hotel units. Our agency is doing some of that as well, and others are. So I think people are doing what they can. I mean, in terms of other vulnerable groups, Meals on Wheels is still providing service to seniors. The community-based home support services are trying to reach out to seniors both virtually and in person. And again, especially for the seniors, we know the literature tells us that having social connection is vitally important. So if you have a senior who you know is homebound, you should reach out to them. The nursing homes here and the long-term care centers have been encouraging families who can to bring the seniors to the family residence if that's possible. But again, the people are trying to do the best they can under the circumstances. And a real shout out to all the community service workers and community health workers who, in addition to hospital and ambulance staff, are doing an amazing job in hopefully flattening the curve, but keeping people healthy.
Well, Steve and Martin, both of you, I mean, it's almost spiritually uplifting. We watched and have seen so much video from Italy and Spain when they were in the depth, and they still are in a really hard place. But we would see opera singers come out on their balconies, and everybody was social distancing, but they would sing every night. And in Spain, where it started with the people clapping every day, we're an interesting beast, people, because we find ways to make these connections to help us feel better, don't we?
Yeah, we were talking about this the other day, and we see on the media where you have parades of fire trucks and police officers driving by the hospitals, and the workers, and they're blowing their horns, they're beeping, they're cheering, and the nurses and doctors and medical staff are out there with their signs, and they're showing each other mutual support in these challenging situations. You have these ads now that are produced where you have this beautiful music, and you have nurses and doctors, and their signs and support our medical professionals. So we've become very innovative and creative, and there's a lot of public service attention being paid to in this area here to really support the medical and really first responders here. We were talking about vulnerable populations before. One of the other sets of vulnerable populations are the folks that are working in our grocery stores and pharmacies. They're dealing with the public all day. We had a story about a young lady who passed away from COVID because she was determined to go to her job during the senior hours. We have specially designated hours in the morning for senior shopping. She was determined to go there and help, and somehow she caught it and passed away. So those are our frontline workers that we're seeing a lot of ads and memes and tributes on social media to honor them. In regular times, which I'm not sure if we'll ever get there again, these are the folks that are making minimum wage. They're not really heralded as providers and essential employees, but really now they are. And we are seeing a lot of tributes to medical professionals and our frontline workers here. So that's been a very uplifting thing.
Yeah, it has been.
Just to pick up on what Martin's saying, I mean, I think if nothing else, it takes a village,
Yes.
writ large.
Yes.
And I think we all need to do what we can, and everybody's making a contribution. Here in Ontario, hospital construction and infrastructure is carrying on because ultimately we need to do that. Also, I hope that as people begin to look at how to avoid this in the future, that we actually make some commitments to increasing the supply of supportive housing for the homeless.
I want to quickly give you a quick analogy, and then we'll refer to Martin Ricketts and Steve Lurie for more on this. But the trouble with this COVID is that we see no end in sight. We need to have deadlines and specifics as human beings, and we don't really have that with this, which puts us in a state of anxiety. Think about World War II and the people who lived in London, England during the Blitz, which lasted for years. They had their food rationed. And they didn't know when the war would end. They had a limited amount of food. They would go to their homes, but at night they had to go live in the tube stations so that they would survive. And it went on for more than a year. So the crisis that we find ourselves in is one that is not quite that similar, but we're doing things differently than we've ever done them before. The point that I wanted to make was, I think that the season change from winter to spring is helpful for us. Is it, Steve?
Yeah, I think it is. And just to continue on with the historical analogy, I mean, certainly the great flu pandemic of 1918, 1919, went on for almost 2 years. But I know that while there's been a lot written on it, my grandparents and even my parents, some who were alive at the time, never really talked about it. So I think we can get through it. I think the beauty of spring is that as long as you social distance, you can go out for a walk and you can see buds, you can see sun, you can feel the warm sunshine, even if it's accompanied by a cold breeze. And it's going to get better and it's going to get warmer. And so I think from a sort of a health promotion point of view, the public health guidelines here are you can take a walk as long as you social distance. So I would encourage people to get out and enjoy the beautiful spring weather. At the same time, I would also say that we need to be ready potentially for more COVID-like things that might happen in the fall. And but some of the same points that we identified earlier in the program about developing your own personal wellness plan, avoiding staying glued to the news, paying attention to the public health advice that you get, exercising even in the winter. You bundle up and you go out on one of those sunny days when the snow is sparkling. Obviously, they don't want people flocking to the parks for toboggan races and stuff like that, but you can go for a walk even if we end up having to deal with this in the fall. I think the important thing to remember is that there are supports that we can provide each other, but there are also supports in the community, as we talked about earlier, and there's great resources on the web for people to think about what they need to get through this. And there are also resources like opera and movies that are being streamed live, so you can give yourself a break on this, and we'll all get through it.
Yeah, and we'll put up all of these websites that you can go to on our website, on television, and of course we'll have them as documents for you on the podcast. Martin, in New York City, which we've watched very closely here in Canada, the blossoms are out, the cherry blossoms. It looks nice, right? And is there a sense of hope? And because New York has gone through things like 9/11.
Yes, we've gone through a lot of things here. Right now, there is a sense of hope. Actually, as we've been talking for the last hour, the sun did come out again. The rain has stopped. So that definitely helps our moods here. But springtime, again, is a time of rebirth. And you were asking the question earlier, is it better to have had this in December, January, or now? And I'm thinking to what I was doing in December. My wife and I were vacationing in San Francisco. So that would not have been a good time to have gotten this. Timing is everything, but things work the way they're supposed to work, is my belief. What we're looking for, though, is kind of the all clear signal here. I gave the analogy the other day about my work at Rikers Island. When there was any kind of disturbance, there would be an announcement. People would be frozen in position. You couldn't move. You couldn't do anything. And then when the disturbance was quelled, inmates were separated, whatever needed to be done, officers went back to their posts. We got the all clear signal. All clear, resume institutional activity. We are waiting for that all clear, that light switch, that signal that says that we can go back to some semblance of normality here. And that's what the big mystery is here. What is that all clear signal going to be? Is how much does the curve have to flatten? Will there be mandatory vaccinations for people? Having had it, do I have the antibodies to prevent me from getting it again? So what actually is going to be the signal that says, okay, folks, we can go back to our lives?
And on that, thank you, Martin Ricketts Jr. in New York City, for your insight from south of the border. Steve Lurie, for the perspective here in Canada, all the frontline workers, we appreciate your work. Certainly from Sumon Chakrabarti, who's been working with Trillium Health. Thanks for joining us today as well. You have been watching another episode of Viral Weather from the Weather Network.